Welcome to this webinar, Air Quality, Health and Technology, which is joining up the dots and brought to you by our host this evening, Clean Air Cheltenham. I'm Adam Hart. I'm Professor of Science Communication at the University of Gloucestershire, so I'm based in Cheltenham, and I'll be introducing our speakers this evening and chairing this event. My apologies for the background noise, I'm afraid. A classic Zoom call child in the background. The plan this evening is pretty straightforward. We have two expert speakers with us, and thank you very much to them for giving up their time this evening. They'll be talking about the themes of the title. First up, we'll have Dr. Charlie Sharp talking about air quality and health, and secondly, Dr. Adrian Watson to give more depth and detail on some of the problems and some of the technological solutions that are available. After that, we'll throw open the floor for questions, discussions and debate, and I will try and marshal that through the Q&A, which we've established works thanks to us chatting about that earlier, so that's great. So I'll keep an eye on that. Of course, we're may not be possible to get to everyone in the hour, but we will most certainly do our very best. On which note, let's crack on. Our first speaker is Dr. Charlie Sharp. Charlie is a respiratory consultant who I think it's fair to say has been pretty busy lately. He is closely involved in the development of integrated respiratory care in the Gloucestershire integrated care system and the coordination and delivery of COVID-related services. Dr. Sharp's area of clinical interest include interstitial lung diseases and acute respiratory failure, and he has a particular interest in disease prevention. And it's that interest which led him into the area of air quality and air pollution. Dr. Sharp's been involved in work with the British Thoracic Society around sustainability in healthcare, and he's trying to drive that agenda within Gloucestershire. So, Charlie, it's over to you.
Great, thank you very much, Adam. Thank you all for dialing in. Presented as an expert, I'm by no means an expert, I'm an interested clinician, I think is probably a better description. But as Adam has set out, this is a very pertinent area for me. Air quality particularly impacts on respiratory disease, lung health, and so I've developed a keen interest. While there are a huge amount of global issues with air pollution and air quality, and you could talk for well over an hour on this area, and many people have written excellent books, I'm going to focus on the issues which are particularly relevant to the local areas and Cheltenham in particular. In fact, our own government in 2016, the Environment and Food and Rural Affairs Committee in 2016 described air quality and air pollution as a public health emergency, and the numbers there on the screen give you the scale of the issue. So over 20,000 hospital admissions as a result of air pollution related disease, more than 6 million days off work, 40,000 deaths a year, and a social cost therefore of over 20 billion. And this all impacts most on those in deprived areas. It is one of the great uneven challenges of our times that the well-off people create most of the problem, and it impacts most on those who are deprived. In particular, those who are living, learning, working near busy roads, though actually road pollution is not the main source of pollution for the impacts on air quality. In fact, that's agriculture. But also I saw today simple things such as solid fuel burning stoves. So 8% of the air pollution comes from these wood burning stoves and causes a huge amount of problems with PM 2.5 particles. And air pollution results in or increases risk of cancer, asthma, COPD, stroke, heart disease, dementia, obesity, diabetes, all of the most prevalent diseases of our time. So this is something that if we're able to improve air quality, the health impacts, the health benefits are huge. So in the short term, if air quality is low on a given day, you get inflammation, irritation, coughing. If you've been out in London, particularly on a hot day when there's a huge amount of traffic, you'll know that you take some time to get over that. You feel like your lungs are clearing that muck out, And we see that in hospital as well. You can forecast hospital demand based on air quality. And people are hospitalized more both on high air pollution days and also in the days thereafter. And then in the long term, lung cancer and heart disease and stroke results in early death and the catastrophic impacts that has, but also in those who are most exposed, it impacts on our children, stunts lung growth, prevents healthy lung development, and then later in life also increases risks of diabetes and dementia. And one of the things we saw with COVID was that those most at risk of developing severe COVID, those who had the greatest risk of dying from COVID, were those who lived in areas with the worst air quality. So this is a serious issue which we need to address as a matter of urgency, and the description of it as a climate emergency and a public health emergency is absolutely spot on. So what does the damage? So the main things when people talk about climate change, they mostly focus on carbon dioxide. That's not a problem from an air quality, air pollution point of view. Far worse is nitrogen dioxide, and this was one of the difficulties in the early noughties. People focused on carbon dioxide as the emission of interest, and therefore the government incentivized uptake of diesel cars. However, they put out particulate matter, they put out nitrogen dioxide, which is incredibly harmful when it comes to all forms of health. And then particulate matter, and this comes, in fact, the biggest contribution in our country comes from agriculture, in fact, for PM 2.5. And as I say, from talking about middle class affluence, people with wood burning stoves result in a huge amount of harmful emissions into the air. And PM 2.5, there's no safe identifiable level. It gets into your lungs and causes all of the problems I've mentioned before. And what's the issue locally? So as you can see, there are levels above WHO recommended limits in Cheltenham. There are 2 schools, care home, GP living in those areas. The problem is a huge amount worse in Gloucester, and those of us living in this area will know that goes back to my previous comments about this being something which impacts on those in the more deprived areas and with the most constrained circumstances. So this is an environmental impact of inequality. And there is consensus, particularly in the medical profession, that there's a duty to act. The Marmot Review 10 years on, so Michael Marmot produced a seminal study of health inequalities in 2010, which highlighted the impacts on our nation's health and actions that could be taken to address that. And he reviewed progress 10 years on, the conclusion being we haven't got very far. And he said that health inequalities are not inevitable and can be reduced, and avoidable health inequalities unfair, putting them right as a matter of social justice. And I've got a huge amount of respect for Michael Marmot, somewhat a hero worship maybe, but he certainly has a track record of being right. And then Sally Davies, who demitted as Chief Medical Officer, allowing the timely appointment of Chris Whitty. You do want an infectious diseases specialist when there's a global pandemic going on, as opposed to a hematologist. But she was excellent in the role and certainly addressed inequalities and fairness. And her words, we must account for pollution within health inequalities agenda and address and plan to prevent and reduce pollution in the context of equality and fairness. So, as I say, I speak as an interested clinician who's made myself aware of the issues rather than as an expert per se, but that sets the context of the impact on health. I'm now going to stop sharing and hand over to Adrian.
Thanks, Charlie. That's really interesting. I'm going to just introduce Adrian whilst he sorts out his screen. And then we're already getting questions in on the Q&A. So once we get to the end of both speakers, we can start to get to those. So our second speaker this evening is Dr. Adrian Watson. Adrian's head of school at the Centre for Alternative Technology over there in glorious West Wales, just north of Aberystwyth. He's been head of school there since May 2018, but before that, he was head of division of chemistry and environmental sciences at Manchester Metropolitan University. His background is in environmental chemistry, specialising in air quality and its impacts, especially on health. And his work has included the assessment of tobacco smoke in indoor spaces back in the days when people were allowed to smoke inside. It still amazes me when I remember that the first time I went on an aeroplane was a flight at 18 and people were smoking on the plane and people smoked on trains, and you could even smoke in my local cinema. How times have changed for the better in that case. He's collaborated with organisations and institutions in the UK, including the NHS, and overseas, especially in Indonesia. So please, let's welcome Dr. Adrian Watson. I'm hoping he's there. Hi, Adrian. Good.
Thanks, Adam. Yeah, as Adam says, I joined CAT, Centre for Alternative Technology, just over 2 years ago. And before that, I did a fair amount of work looking at air quality, from indoor air pollution all the way up to sort of climate science. But my interest was always on the impacts of air quality on health, and while I don't profess to having the clinician's view on that, I've certainly looked at it from the point of view of air pollution and how we can try and address that. And really, what I wanted to talk about today was following on from what Charlie had talked about, was the fact that this is not new. I mean, Charlie talked about sort of 40,000, up to probably about 40,000 deaths in the UK. You can go that multiple times across Europe and the US. And as people will have read, there was a recent landmark decision by the Coroner's Court in London, where a young girl who sadly died when she was in 2013. The cause of death was stated as air quality and air pollution. But it's not a new issue. You know, we've known about this for a long while. A colleague of mine at CAT sent me this picture, which I thought was great, and going back to the early 70s. And okay, it's somebody in an open-top car, but this concept of pollution being drawn from transport is not something that is novel, and it's something that we've tried to address for many years. And the kind of pollutants that we tended to find from the sort of 50s, 60s, 70s, probably up to the early 80s, we've done enough work through Clean Air Acts to sort of get rid of those. But certainly the growth in air pollution since the sort of 80s and 90s has been largely driven by transport and increased fuel use. And it's led to the kind of issues that Charlie's been talking about. And really, because of the group I'm talking about, I'm really going to focus on transport and show how it's grown, and look at some of the solutions. And some of the solutions are technological and some of them are more policy driven. But to get some kind of context to start off with, hopefully you can see my mouse as well. These are the road traffic estimates. This data is from Department of Transport and shows that if you take the amount of traffic on the road in 1994 as being 100, you can see how the traffic has grown since then, particularly in when we're looking at sort of cars and taxis has grown to 30%. Sort of vans for sort of local deliveries has grown massively over that time. Heavy goods vehicles has dipped and rose and dipped, but it's still above where we were in 1994. Interestingly, public transport, buses and coaches is the area that's probably dropped, but personal transport has all increased, and we've now got a combination. We're driving about just under 360 billion vehicle miles a year, and it's increasing a couple of percent a year. Obviously, I'm showing you 2018 data rather than last year, because last year was somewhat affected by COVID. So we're seeing road traffic really increase over that time, and in part, the people have been driven by policies towards personal transport, and the cost of personal transport in real terms has generally fallen, so it's more affordable for people. So we need to think about, if we want to we've got that growth in the car, which is led to using more petrol, more diesel. We've got to think about what alternatives will be, and we've got to look at what we can do in terms of producing sustainable transport and different modes of sustainable transport, and what we can do instead. And within all these, we've got to think about things like how can we keep people mobile? How quickly can we move people? What do we need to do for planning? Is all this transport equitable? Is it accessible? Because if we stop people travelling by their own personal use, what else can they do? We need to think about societal needs, and all these are in addition to the environmental aspects of air quality, noise, and things such as that. These are the sort of different modes of different kinds of sustainable transport that most people, I'm hoping, will be aware of. You've got the sort of the ideas that we really think of accessible and sustainable transport, walking, cycling, but we also need to think of more public transport routes, so buses, tram systems, which are a more recent innovation, inverted commas, because the first sort of light railway system, new one, was really in Manchester in the early 90s, but you can go back in time and see trams being used in the 1930s, etc., around the UK as a fairly normal route. We've got taxis, other forms of personal transport. We've got aviation, which we don't automatically think of, but this is if you're living in remote areas. So this plane is the plane that goes from Westray to Papa Westray in the Orkneys, and it's an essential requirement for transport there. And then we've got, just for the purposes of this, and I'll try and avoid it, what about things like trains? This is this picture of what it's envisaged HS2 is, and is this something we consider sustainable or not? And it's difficult, because are all these systems, are they all accessible? Are they all sustainable? I mean, the example I would say, most people would say the sort of city bikes type route would be a sustainable route. And I put this picture up because a place I used to live, which was Stockport in Greater Manchester, introduced a series of city bikes, and they lasted about a week because the local population there just vandalised many, and they ended up being removed. And so you had issues about accessibility, local vandalism, the local issues. Local context really needs to be taken into account when you're looking at mechanisms for sustainable transport. So what else can we do? If we're going to try and move people away from the car, which is the cause of most of the pollution that Charles has been talking about, what can we do instead? Well, a number of areas recently, and I believe you're getting a talk in a couple of weeks from a representative of Birmingham City Council. But a lot of city councils are now looking at low emission zones, where the really high polluting cars are trying to drive them off the road, the older cars, by enforcing congestion charges or low emission zones where you have to pay additional sums of money to enter certain areas. And the one that's most famous in the UK is probably the one in London. And within this congestion charge area, which will be the centre of London, small area, it will be £15 to enter there. To enter the low emission zone, the ultra low emission zone for cars and vans, it'll be £12.50. But if you're driving a larger vehicle like a lorry, a bus, then you will be charged £100 per movement across that border. Now, this is an economic route about trying to keep your air clean, but there's also the element of social equity, because there will be people, the poorer, which Charles has already said is more disproportionately impacted by air pollution, who may not be able to afford to pay £15 or £100 for their work on a daily basis. So all these things have to be balanced, and obviously I'm quite happy to promote the fact that these will bring down air pollution. When the congestion charge was put into London initially in the early 2000s, it did drop pollution by about a third, and that had a reduction in deaths in the area. But there is the social equity that we need to address as well. We need to think about what alternatives we can give people. And my favourite route in general is to try and move towards integrated transport systems, where you provide people with alternatives such as buses, tram systems, integrated with walking, etc. So you've got a mechanism which allows people to have movement around reasonable areas. This is the new transport system that's being proposed for South Wales. Put that there because I'm obviously living in Wales at the moment. And this is planned between over the next 3 to 4 years at a cost of several £100 million to extend what already exists. A metro system that's running, focused around the Cardiff area, around the airport, around Newport, and satellite towns such as Merthyr Tydfil and Bridgend, and try and integrate what's going on so that the buses, the trains, other systems all start to integrate. And there are now a number of these starting to come together around the UK, and the people who are listening here may be aware of some which are more local to them. Nottingham's noted for it, Manchester's noted for it, Leeds is starting to get something as well, Newcastle. So there's a number of these around the country, and these provide that alternative, and we need an alternative if we're going to drive people away from their cars. If we're going to stick with cars, then in the longer term, we want to try and get people away from petrol, diesel, and moving into more environmentally friendly vehicles. And the way that it's being promoted at the moment is by moving towards electric vehicles. The government has announced they originally wanted all new cars in the UK to be electric by 2040, but they've been consulting and they're trying to bring that date forward as far as they can. And the development of electric vehicles has been incredible for the sort of older people like myself amongst you. You know, the initial electric vehicle was the only vehicles that we knew were things like milk floats that travelled at 3-4 miles an hour and had a limited range. Now the range is much better. You've got cars such as the Tesla. Most manufacturers are now phasing in all electric. I think Land Rover announced that they were going to go all electric from 2025. So it's a great route, and I think that we may start to hit that target by around 2030 for all new vehicles. We've also got hydrogen fuel vehicles, which are even potentially, I think, this more medium term onwards. Where this is the River Simple car, which is being designed in Wales at the moment. It's a factory which is being run by I think it's the old Morgan company head, and it could be a really viable alternative to even the electric car in future. But even these are not entirely free of environmental impacts. They all tend to use lithium-ion batteries, the same kind of technology that's in your phone, and I'm guessing most people here will have had more than one phone, and that's because batteries will wear out with time. But the newer batteries are getting a lot better. The new technologies are getting better, and it would not be unreasonable as we move on future to sort of get about 7 or 8 years out of a decent battery before they're replaced, and that will remove a lot of the emissions that Charlie's talked about, although there may still be PM 2.5 issues with tyre wear. The people who've talked about EVs and range anxiety, this is my only slide which we may mention Cheltenham, because I'm not from the area, but people have really been concerned about the take-up in electric vehicles and the number of charging points. But as you can see from the graph on the bottom left, that the number of charging points nearly countrywide is increasing almost exponentially, and we're now getting close to nearly 40,000 charging points. And even just in Cheltenham, there's quite a few just within a couple of miles of Cheltenham. And most people's typical commutes tend to be up to about 30 miles, 40 miles. And if you've got that, you can get quite a way. And most electric vehicles will now get that. So an electric vehicle is now becoming a viable alternative to the old gas guzzler and diesel cars that we've had since the turn of the last century. You developing that in Mid Wales, we're starting the development of car clubs and using EV as a way to do that. And one of my colleagues, Suzanne Yupper, and I put her name there. These two next slides are hers. Is that we're trying to develop car clubs which are based around the electric vehicle and really make these vehicles as community vehicles. Mid Wales, which is effectively Powys and Ceredigion, where I live, are the least populated parts of Europe. So they're known as being extremely rural. And if people people are isolated. If people don't have cars and vehicles, they become isolated, and that leads to health issues, poor health outcomes, deprivation. People will still need to travel. They'll need to travel for food, for socialization, for jobs, for education. So we still need to provide something. But what we're trying to do in North Paris, or certainly what Suzanne's really trying to do, is develop car clubs where we're trying to get people to reduce their reliance on their own personal transport and really coming up with shared systems which are become really viable alternatives. The systems that we're trying to do, as Suzanne's trying to do, is almost trying to do like a mid-Wales sort of car sharing co-op where we have a integrated set of co-ops which are locally community run. We work in conjunction with community partnerships, community trusts, where the locals own the cars and run the cars, and they derive income from sort of short-term hire of the cars and also the charging points. And what Suzanne is trying to do is she's trying to run these things on a local basis, so people are employed locally to run them. There is a sense of real community about these, and the idea that within Wales is that we'll have a series of community-owned car systems where it's owned by and owned for the local community. And certainly in rural areas, I really do think this is a really viable alternative to everyone having their own car. Other things, I would imagine that Charlie would say we should all be fitter and we should all be walking. That's really one of the main things. And it's surprising that how many people actually live within 5 or 6 minutes of a bus stop or 5 or 10 minutes of a school, and yet will still get in the car. So we've really got to, it's not just the technology in there, we've got to educate people, and we've got to change people's behaviour so that we can get them to walk in urban areas or cycle, where previously all they've done is just get in the car. I was talking to an old friend of mine in America on the weekend, and he's got 2 supermarkets in his village. The furthest one away is a mile, and they still drive there. And sadly, that kind of behaviour is fairly common here as well. Probably not the same as it is in the States, but it is common. And we've got to change people's behaviour. And one of the routes that you can do that is redesign your urban centres. Instead of having urban centres which are dominated by the car and they're designed around the car and transport, is actually have shared spaces so that there is a balance between walking and cycling and the car. And this is an area, it's one I'd really recommend having a look at. It's an area called Poynton in Cheshire, where they've taken away the sight lines, they put roundabouts in there to slow the traffic up. There is no pavement, there is no pavement edge, it's a flat side, there is no zebra crossings, but there are walkways, and there's an element of it confuses the driver and it makes the driver slow down. So the speed drops to 20, road accidents drop, and transport pollution drops. But it means that the local shop owners are happy because people can still access their goods. But there has been a change of emphasis away from the car towards its general use by the population. And I'm going to finish with, there are other ways you can do it. You can do bike lanes, which are just promoting other forms of transport other than the car. And I think really that's one of the sort of, it's not strictly a technology, but that's really where we need to go. And I'm going to stop there because it's one of these topic areas where you could go on for an awful long time.
Thanks, Adrian. I'm actually there's a few questions coming in on the Q&A, which we'll get to. I'm actually going to take the opportunity of being the chair. I can ask my own question. To what extent do you think the current situation that we're in, the pandemic, is actually a huge opportunity for us to change the way that we do things with respect to transport? My car's due for its MOT next week, and I'm looking at the mileage that I've done over the last year compared to previous years, and it's night and day in terms of how I've gone about thinking about transport. Do you think
I have a number of slides that I've not shown, but one of the big things is it doesn't sound like it's transport related, but it is effectively it's the use of digital technology. We're now much more used to working online. Charlie will probably have his own views on this, but you can do diagnoses online. We can educate online. I've been into work one day in about a year. And I'd probably, if anyone, I'm sure other people got the same kind of response, that I've probably ended up doing more work at home than I have done when I've been at the workplace. It's not been an easy option. So I think it will become less of a norm that people will be using transport in the same way as they did. And I think one thing we can do is build on the behaviour change that's been forced upon us to build back in a better way, so that we can encourage people to use more sustainable forms of transport. And I think, along with the sort of approach to making people move towards electric, so there really isn't much of an alternative. Once we get sort of like a second-hand market in electric, that will start to really make big changes.
Thank you. And actually, I guess linked to that actually is a question that's come in here from Hannah Dwyer. What impact has COVID had on air pollution in terms of transport? Obviously, working from home and essential travel has reduced that, but do we have a figure on sort of ballpark on what type of reduction we're looking at?
If Peter makes me host, I'll show you a slide. Excuse me a minute. Share screen. These are my figures, so don't quote too much, because I did a bit of a calculation before I came here. This is the effect of transport. This is the road traffic estimate changes that's happened since COVID, and we've dropped by about 19–20%. All forms of transport have dropped 20%. Cars just over 20%, vans by about 11%, but they've been doing the deliveries. And then that was urban air pollution in 2019, and I've chose a couple of sites. So that was Camden, Liverpool, Manchester and Oxford, all fairly major urban centres. Oxford's chosen because it was a major urban centre could get to near you. And that's the pollution from the same sites in 2020. So pollution, nitrogen dioxide pollution has dropped between about 16 and 39%, depending on where you're looking at. That series 8 at the bottom should say Oxford is just a problem with my graph. So pollution has dropped quite an issue, quite a lot due to COVID. But you've got to remember that there were other sources of pollution as well. It's not just transport. As Charlie's already mentioned, there'll be agriculture, there's industrial use, there's domestic use and things like that. So it's never going to drop to nothing.
I'll jump in and just highlight that actually PM 2.5, there's a few studies out there showing that while there were some signals to fall, there's also, it's a bit more complicated than that, and it wasn't anywhere near as much as people thought it was initially. So it's the importance of looking at it as a holistic thing, that, and the whole picture, and the PM 2.5 is probably the most harmful element of that because of the chronic inflammation that it causes and the disease that results from that.
Absolutely. I mean, if you were looking globally, carbon dioxide due to transport's dropped about 7%. So there are different pollutants that will have different effects. Just I use nitrogen dioxide because it's so closely associated with transport. Yeah,
thank you for that. And actually that idea of sort of holistics springboards us nicely into a question that Caroline's put in. This one's for Charlie. In the Indian, Ayurvedic, traditional Chinese and Tibetan medical systems, it's recognized that air is not just the carrier of physical oxygen, but also of a subtler life energy known as prana, ki or lung. Apologies if I'm not pronouncing those correctly, whose quality has profound effects on our mental, emotional and spiritual health. Does Western medicine recognize any psychological or emotional effects of breathing polluted air?
Difficult question to answer. It's a good question, and it's probably an under-recognised area. The recognition of the whole is something which Western medicine is weak on, I would say. We tend not to be holistic in the same way in our approach, and the emotional and spiritual side is focused on in management, where we're talking about symptom-based treatment, but not necessarily in organic disease treatment. But in breathlessness in general, not just looking at pollution, but breathlessness in general, then there's huge impacts from all of those elements of mental, emotional, spiritual side and the perception of breathlessness resulting from that. And anyone who has a chronic lung condition will tell you that they know when not to go out. When the air is bad, they know when not to go out. And there is that fear and that psychology associated with it, that they therefore lock themselves away, isolate themselves. So yes, there are impacts. They're probably not formally recognised, but it's probably an under-recognition and a lack of our medicine rather than anything else.
And I guess a related question or similar one from Caroline here, which I'm assuming might be horribly confounded and quite difficult to sort of unpick here, but how is air pollution related to obesity? I guess
so there's a few different elements. There's the obvious one that if you've got polluted air, then people don't go out so much and don't exercise so much. That's a bit too simple. If it was that simple, it would be a simple fix. Air pollution also results in chronic inflammation. Chronic inflammation is the central underpinning mechanism of all of the diseases of deprivation, cardiovascular disease, respiratory disease, where you have that chronic inflammation that results in all of the long-term consequences. And it's well recognized that the health gap, the social determinants of health, they all result in that chronic inflammation. So that's more likely to be the underpinning mechanism.
Okay, thanks, Charlie. There's a couple of questions here that I think relate to you, Adrian, and they're sort of linked together. One's from Martin Brown, who asked, what aspects of agriculture are most problematic? And then linked to that, Mike Bush has asked, why, if agriculture is the biggest cause of PM 2.5, there were no agricultural areas like East Anglia shown as problem areas in the UK map, but instead it was the usual suspects of heavy traffic centres like London?
One of the major pollutants that's associated with agriculture is ammonia. You usually don't normally find in urban centres, and when you get releases of ammonia from well, it comes from any livestock, etc. It's just emitted. It can form particles in the air with sulfates and nitrates, and that's one of the sources of your PM 2.5s and various other particle sizes. So that's something that's quite specific to agricultural regions, the ammonia. But also you tend to find that most agricultural vehicles are also diesel based, which again links towards your particulate matter. And one of the groups that we've been trying to work with at CAT is looking at developing electric agricultural vehicles, because it would work quite well. You could charge them up at local sites, but the electric vehicles are known for having quite a lot of torque, which is what you need from a big vehicle like a tractor or something like that. So it's a number of things of that type.
I'm muted. It's happened. Thank you very much. A question here for you, Charlie, from Zoe Hoskin. Do we know how poor air quality in childhood can cause an increased risk for dementia later in life?
The direct mechanism probably unclear. It boils down to, as I said, hate to hark back and sound like a stuck record, but chronic inflammation again, but also those elements that reduced activity. There's a huge amount that in early childhood that is modifiable in terms of later risk of dementia, cognitive ill health, that we don't really understand, but plainly the environment is hugely influential, as we see by the fact that dementia is so much more prevalent in deprived communities.
Thanks, Charlie. Yeah, I guess a lot of these things are horribly confounded and linked together and quite difficult to disentangle. Another question from Mike here, and it's one that I've got a little bit of an interest in too, as a wood burning stove owner. I know it's not very scientific, but a few weeks ago, Countryfile tested a proud wood burner owner of a Clearview heat-as exempted stove and burning properly seasoned wood, less than 18% moisture content, and could not detect any PM 2.5. Is the wood burning problem just open fires and unseasoned wood, or should I lose my faith in the BBC?
I'm not a fan of wood burners, but it's a broader response to this, because while you've got if you look at the number of people who die worldwide from pollution, from air pollution, is actually more people die of indoor air pollution in the developing world than they do in the developed world from outdoor air pollution. So I'm not a fan of biomass burning in general, but that's just a personal thing of mine, and I've seen it in places like Indonesia. So that's one. But you can find higher levels of PM 2.5. You can find higher levels of CO2 if you've got a properly installed log burn or something like that. Then it should be usable, and there should be low risk. But not everybody has, and equally, when that wood is burnt, there is a release of particulates into the outer atmosphere as well. So you've got to be a little bit careful about all these kind of things when you put them together. As I say, I'm not a fan, but that's because of the work I've done overseas.
And you mentioned there, Adrian, the fact of indoor air quality. There's a question here from Caroline. She asks, what can we each do to improve the air quality in our homes rather than outside of our homes?
Open your window. Make sure that your house is clean, because in indoor air quality, a lot of the pollutants are not chemical, the kinds that we've been talking about here. They're actually biological, so they're funguses, things of that nature. So try and make sure that your house isn't too damp. Look for a variety of allergens, particularly if you've got young children. That's one of the big issues. If you've got gas stoves, that will also, burning of gas, you'll also produce CO2, nitrogen dioxide, so to make sure they're well ventilated. Don't smoke indoors, although as Charlie would say, don't smoke, full stop. And I would tend to agree with him. So there's a number of things, but there would be a lot of, as I say, indoors, it's as much a biological pollutants as chemical pollutants. But having a good flow through of air, good ventilation in your home is probably the best thing you can do to improve your air quality indoors. That's slightly counterintuitive when you're trying to keep an insulated home from an energy point of view, but from a air quality point of view, having a flow through of air is the best thing you can do.
Thanks, Adrian. Sorry, getting a little bit of a background noise from a child here. Thanks for that. Yeah, I guess with indoor air quality, one of the things that I learned about recently was volatile organic compounds that come off plastics and so on, and carpets and all sorts of other surfaces, which I hadn't realized was quite such an issue. Is that something that we should be concerned about, and we should be looking to degas our appliances before we use them and things? Or
there's also, I mean, typically most odors that you can smell have usually got an organic route to them. So if you, I mean, we use these positively. If you use toilet cleaners, disinfectants, they have a pine smell or a lemony smell, and those are chemicals known as pinenes and limonene, and they're done to make it smell clean. And if you buy new furnishings, you tend to have a new furnishing smell. There's a lot of work gone into this, and a lot of you looking at the construction industry as well, because we try and make sure that the fillers that we use and the boards that we use don't emit VOCs into your indoor environment. But they are there, and they're also there in external pollutants as well.
Yeah, thank you. There's a question here on the chat from Kate. Can indoor plants help with air quality?
Yes, they can. And if nothing else, there's a psychological effect about improving your well-being and your health from having plants indoors. I believe that they looked at some of this with some of the early space flights to see if they could help clean up the air as well. But in general, they can help. But there's been some studies looking at things like vegetated walls and moss walls outside to try and clean up outdoor air quality as well. And there's a couple of those plans in central London and around some European cities as well. They will clean up the air. They will moisten the air for you. They will cool the air, so it's making it more a better environment to live in. But they won't reduce all the pollutants. But I would certainly think it's a good thing to have.
Yes, and yeah, linking in through that and well-being, we've got an anonymous attendee who's asked a question of possibly both of you, but I'm guessing more Charlie. As a teenager, I see that mental health problems are prevalent in our generation. You said that mental health could be affected by pollution. Could pollution be a factor as it has increased, especially around the early 2000s? So could there be a lag effect with current teenagers, or is that much more complex?
I think it's, I'm not particularly qualified to answer, but I think it is impossible to say. It's far too complicated to try and address that, because life has changed so much and out of proportion to anything that's happened in preceding 20-year periods. The revolutions that we've seen in technology and online behavior and isolation of youth and everything over the last 20 years means it's impossible to tease that out.
Thanks, Charlie. Yeah, and a couple of linked questions here. One is from Peter, I think. How polluting are incinerators, e.g. the new one at Javelin Park, which is a local incinerator, in terms of particulates? And then linked to that and kind of following on, airflow in the home is deemed helpful. How does wind and air movement outside impact on pollutants? And that's from Rod.
When you're looking at something like an incinerator, it's a point source of pollution rather than a mobile source, which is like transport. And it depends what you burn and how you burn it. And there are legislation associated with the combustion in incinerators. They have to reach a certain temperature to make sure that the combustion is complete. And they also associate them with having a high chimney, because if you disperse your pollutants at a higher level, they travel further and may not come back towards the ground. It's not the case with everything, but it's a mechanism for getting rid of waste in as clean a manner as you can do. I know there's been issues. Around Liverpool and Manchester about sort of things like clinical waste burning, or burning of contraband materials like cigarettes that come in through ports. And it is a cleaner mechanism, but certainly it's a very visible source of air pollution, and it's certainly one that's really emotive. What you really don't want is a large chimney and from an incinerator being situated within a valley, because if the smoke that comes out of the incinerator, even if it's going at a high level, can't escape from a local region, it will end up still being trapped within your local area. So you have to really look at them individually, but there are, as I say, there are criteria by which you have to get really high temperatures and disperse your pollutant at a high level, so it goes at long distance rather than on a local basis. And the other question was?
How polluting are incinerators, and airflow in the home is deemed helpful. How does wind and air movement outside impact on pollutants?
Basically the greater the air movement outside, but it's more dilute, and we've seen that through COVID, that if you're indoors, you've got more chance of being exposed because there's lower air movement. The way I always tell people is if you want to feel where air is moving, use the classic route of licking your finger, sticking it up in the air and feeling how the air moves. Take your finger from your head and then move it down to the ground. And as you move it to the ground, you'll feel that the air will move less and less and less until you get to the ground where it doesn't move at all. These are called boundary layers. But in normal situations, that the air movement outdoors is sufficient to disperse pollution, urban pollution, within the day, from the pollution being generated to being dispersed within a typical 24-hour period.
I spent some time in Mexico City in the late 90s or 1990s, and they had a tremendous air pollution problem. And one of the solutions being discussed, I think quite seriously, was the installation of giant fans to literally blow the air out. I think they switched then to an odd even registration number plate system to reduce the amount of pollution coming in. Have there ever been around the world any sort of serious attempts to blow the pollution away, or is that just
not that I'm aware of? No, I've known a number of cities do the odd even approach.
Athens was an adopter of that, I think, wasn't it?
Paris, Milan, but the trouble is people will People will
Buy
buy
two
two cars.
Yeah.
And they'll try and get around it that way. So we've seen that, and that's partly why it's a behaviour change issue as well. You know, we need to get people using other active forms of transport. We need to get people walking, and we need to get people not trying to cheat the system. We need to get people to understand why we're doing it and work on alternative forms of transport.
Yes, if there's one thing that we've learned over the years, is that if there's a loophole, people will exploit it, often with the reverse consequences of what we're after. There's a question here for Charlie. It's from Dr. John Boys. It says, does Charlie think that it is the PM that promotes virus particle transfer amongst people, or the associated higher density populations that usually come with more polluted air?
I am going to, despite my knowledge of John's politics, I'm going to assume he means that PM 2.5 rather than the Prime Minister.
Yeah, that's what I was
but I think that the majority of the increased risk is from housing density, working conditions, the fact that people in deprived populations and in therefore lower air quality areas, they have to get out to work, they live in multi-generational households. I think that that's a large element of it, but pulling back to what Caroline's asked, one of her questions was whether there's a relationship between COVID and air pollution. I think that chronic inflammation picture as well, that I've bleated on about, that also has a role, and therefore having PM 2.5 can carry the viral particles. People will be more vulnerable to that infection, and the environment they're living in increases their exposure. So it's a double hit, but primarily due to the conditions people are living in rather than and their underlying risk rather than the PM 2.5 directly.
Thanks, Charlie. We're coming up actually to the end. So if you have any more questions, please do post them on the Q&A. There's a question here from Caroline for Adrian. It says, during a recent CND seminar, I learned from Professor Andy Sterling, Science and Technology Policy, Sussex University, that if we are using electricity sourced from nuclear fuel, we are inadvertently contributing to the manufacture of nuclear weapons. So closely are the military and domestic industries intertwined. Are other technologies being researched or in development, apart from those powered by electricity, hydrogen, wind or sun, which could be used to run cars? So is there anything else in the pipeline?
The main sort of longer term one is that I'm aware of is hydrogen fuel cells. And certainly I think one of the things that I think will be really helpful, really useful, is if there are better batteries in future. So once we create this energy using the techniques that Caroline mentioned, the solar, the hydro, wind, etc. If we need to be able to store that better, and actually we need to be able to, the batteries we need to be lighter and provide that power range. And I did know some research that was going on using graphene technology. It's not there yet, but that would have a potential of having much lighter batteries if it can be incorporated in there, and potentially to get the same range. And I think that's really what it is. Really, I mean, nuclear that's an emotive topic area for a number of reasons, and there are different types of nuclear. But really, it's ultimately what we need to do for climate change is get people not just thinking of alternative ways of creating energy, but actually using less energy as well. And it's a mixture of all those things together.
Thanks, Adrian. And what looks to be our final question this evening is from Victoria, and it's perhaps a good one to finish on as well, with a local flavour. What could Cheltenham do to reduce transport carbon emissions? And I guess for that you could read, what could anyone do? What are the sort of top 5 things that people can do, or top 3 things people can do?
Get on your bike.
Yeah.
Get on your bike, walk, think about the long-term benefits to your health from using other modes of transport that aren't getting in the car, and also the benefits to air quality that result. Adrian's probably got some other more creative answers.
Somebody just put re-regulate buses, and I didn't mention this, but buses were deregulated in the 80s, rail was deregulated in the 90s, with the exception of buses, the exception of London. And I think if we to get that integrated transport system, I think there is a sort of a good argument for re-regulation of buses to allow it's easier then to generate and create an integrated transport system. But I'd agree with all the things that Charlie said. I'd also advocate the school run. I'd ban cars within a couple of miles of each school, because kids need to get used to walking, and if you bring it in at a young age, it will become the norm. And a lot of the pollution around schools is generated at those rush hours where people can find ways of walking to school. My kids used to walk to school. My neighbours up the road used to take them in the car, and my kids would overtake them in the car because of the congestion that was there. It was ludicrous, but they wouldn't walk, and it was ingrained in them. It's a behaviour issue. So I still think that we need to change people's behaviour on that. So I agree with Charlie, more public transport or improved public transport that covers all the areas and is integrated within the Southwest.
I think making it easy for people to make the right choices. So yes. If we're talking about making it easy to cycle, then better cycle lanes. Cheltenham is fairly cycle friendly, but there are still major barriers to doing so. For instance, a decent cycle path between Cheltenham and Gloucester would be a game changer. Making it easier to get on the bus. It's about reducing the barriers to making the right choice.
Yeah, I don't know specifically about Cheltenham and their bus network, but once you get into large cities and you've got deregulated buses, sometimes you can have problems with things like ticketing, and you can have to get a different ticket for each different bus provider, and that provides it's a barrier in people's minds towards using a bus to go longer distances or going across a city, and that's where that sort of integrating these things is much better.
We're only a small town, and we've got 2 or 3 different bus providers which aren't integrated. So yeah.
You know what, that is an excellent place for us to finish up as well, making it easier for people to make the right choices, but also talking about transport, because Clean Air Cheltenham, and you can visit Clean Air Cheltenham's website, cleanaircheltenham.org, has the next event on March the 9th, and it is creating a sustainable transport plan, and that's going to be chaired by Jonathan Porritt. So if you've enjoyed the webinar this evening and the idea of urban transport, something that wets your whistle, then do join that webinar on March the 9th, which will be very interesting. I'd just like to thank both of our speakers this evening, both of our panelists, Dr. Adrian Watson and Dr. Charlie Sharp. Thank you very much for giving up your time this evening and for sharing with us your views and expertise. And thanks also to Clean Air Cheltenham for hosting us and for making everything run relatively smoothly. And thanks to everyone for coming and for posting your questions and getting involved with the discussion. So thank you all, and have a good rest of the evening.
Yeah. Thank you. Best.
Thanks on behalf of Clean Air Cheltenham. Thanks to all you guys. We really appreciate it. Thank you very much.